The best of days for Brenda Pogue. She arrived home.
They lined the road and were yelling and had signs, and I saw students and co-workers and church friends and strangers. It was amazing. It was amazing, but it was best to see my family.
It had been 8 weeks since Brenda could spend time with her family. She shares her COVID-19 journey.
I had a little diarrhea for a few days, and my husband noticed my breathing was funny and took my oxygen count with one of those finger things, and it was low 90s, but I said I felt fine.
So anyway, we decided to wait, and the next morning was up early, and we put that same device on her finger, and her oxygen was 87. So I knew something was really off. So I did call a doctor, and he said, call 911, which I did.
The ambulance came, and the last thing I remember is the one person saying, can she walk to the ambulance? I said, oh, sure. And they took me to Hershey Medical Center.
And you arrived in the hospital. As far as your recollection, what do you remember?
That was on April 4th. I do not remember anything. Yet my husband says I called him and I talked to them on a phone. I don't remember any of that.
Brenda called to tell her husband the results of her COVID test.
And she said, you're not going to believe this. My COVID test came back positive. She said they want to put me on a ventilator just for a day or two to try to get my oxygen up.
That night, Cliff received a call he'll never forget.
I got a call from a doctor that told me the situation was dire and they weren't sure that she would live till morning. So it was just, she was on the ventilator from, say, noon, 1, whenever. And it just happened so quickly. It was just unbelievable.
Brenda survived the night, but the next several weeks were not easy.
Her kidneys completely shut down. That was the next thing that, could have ended her life.
After a month in the hospital, Brenda improved. The next step was Penn State Health Rehabilitation Hospital.
They were very nice. They had to teach me how to get up, sit up, and they had to help me get out of bed. We had PT, speech therapy, occupational therapy, at least 3 times a day, and sometimes more.
I used to drive over there, sometimes with my daughter and my grandkids, and luckily her room was on an outside wall, so we could go to her room and we could talk to her through the window. After
a month, Brenda got the green light to go home. Family and friends surprised her.
Glad I fought. Very glad to be home.
Did you see the banner that my daughter had made? It has like 350 people. She decided it would be a nice thing to have for when Brenda got home.
I couldn't believe it. Just so glad to see everybody. Yeah, finally.
That day, to see that many people show up was just, it was just amazing.
Another very special moment for Brenda was to see the birth of her granddaughter, Parker Bell.
She's what helped me get through. She and my grandkids. She was to be born around Thanksgiving, and I knew I had to be here to meet her and see her. And she decided to come early, and she weighed 3 pounds, 6 ounces, and that was very scary, but she's doing great.
Brenda is thankful and is grateful she made it through.
She is doing great. She's back to normal, all regular activities.
I feel fine. I get tired, but I understand that's one of the long effects, but I feel fine. Yeah, I'm so glad to be here.